Welcome back to another episode of Don't Waste the Chaos. I'm your host, Kerri Roberts, and today we're diving into a conversation that could reshape how you are thinking about employee benefits and healthcare expenses. Joining me is Brian Whorley, the visionary founder behind Paytient. He and his team have a groundbreaking approach to helping employees manage medical expenses. In today's episode, we'll explore the story behind Brian's journey and what inspired him to create an alternative model that's making waves across industries. We'll discuss the impact this model is having, how it integrates with traditional insurance plans, and the benefits it offers to both employees and employers. Brian will also share insights on overcoming market hesitations, real-life success stories, and his advice for business owners considering this innovative approach. But first, let me tell you a little bit more about our guest. So Brian Whorley is dedicated to improving patient access, affordability, and responsible autonomy. He is the CEO and founder of Paytient, a benefit that 6,000 employers provide to help people self-pay for care. Prior to founding Paytient, Brian previously served his community for over a decade in a nonprofit, locally owned 392-bed hospital in Columbia, Missouri. Brian received an undergraduate degree in engineering at the University of Missouri and his grad degree from WashU in St. Louis, also my husband's alma mater. Now, I met Brian in the Como business community several years back and have been inspired by his passion and desire to impact the world in this area. I can't wait to share a piece of this energy with you today. Brian, welcome to the pod.
Kerri, thank you so much for having me. It's a real pleasure to spend this time with you and your listeners.
Yeah, so super excited to jump in. Let's go ahead and give the listeners what they're here for. So let's start out talking about the story behind why you founded your company and what inspired you to create this alternative approach for helping employees pay for medical expenses.
Yeah, I loved working in a hospital. So I worked at Boone Hospital Center. It's Boone Health now, based here in Columbia, Missouri. And I worked there forever and ever. It was the majority of my career. And I loved every minute of it. I loved being part of a place where people in my community, friends, family, neighbors, Columbia is not that large of a town, but it was really just fulfilling to me to be part of a team and place that people would turn to in very uncertain, very personal moments where they needed care, where someone in their family needed care. That moment where people walk in the door, it's an incredibly uncertain moment in your life, some of the most uncertain moments in life. And I find in those kinds of moments, that's where you're best able to serve. You're best able to help others in those moments that we all go through in life. And I felt that helping people to pay for care, helping to give them certainty in that uncertain moment would be welcomed, would be appreciated, would be sort of a felt benefit. I sort of looked at the world at large and the sort of societal shift of employee benefits sort of going the same way that retirement went, which is this sort of movement from defined benefit to defined contribution, or the shift of responsibility from employer to employee. I feel like that is a long-term kind of secular shift. And I wanted to better equip people for that increase in responsibility. And so founded Paytient in April 2018 to give people a better and easier way to pay for care. Our product is a fintech product, but really, Kerri, it's a healthcare business. We're in the business of honestly helping people to live happier, healthier, longer lives. And because we understand there's a link between your ability to pay for care and whether or not you actually get care. And we wanted to, like I said, make that moment where folks are seeking care or thinking about care. We wanted to help solve for financial capability within that moment.
Yeah, so you've been at this for 6 years. I didn't realize that, or over 6 years now. So congratulations on that. And I'm sure you've seen a wave of things throughout that journey. But what kind of impact are you seeing across industries with your approach to employee medical expenses? And how is that changing, do you think, the landscape of employee benefits?
Yeah, I think you'd have to be deaf, dumb, and blind to spend the better part of 20 years inside a hospital and not see that look on someone's face when they walk in the door. You'd have to be deaf, dumb, and blind from a benefit providing position, whether you're a consultant, a broker, or whether HR manager, others to to not see and understand that as we shift more of the responsibility to people, which I believe paradoxically is a good thing. I think that is a good thing that we have more responsibility for ourselves. I think that the awareness is there that someone's ability to pay for care affects how they get care. And so what we're doing with Paytient is I was certainly aware of this relationship, and I was aware of sort of the kind of use like plight of the out-of-pocket payment, where like how much uncertainty there was. I didn't understand how impactful and how meaningful and how increasing one's ability to pay for care changes how they get care. I just didn't fully, I understood academically what it meant. I understood what it meant for us as a provider of care, but I didn't fully appreciate and understand that when you increase someone's ability to pay for care, it changes how they insure themselves. So it changes when they go for care, where they go for care, how often they get care. It changes the type of healthcare that folks get. And so whether someone has a low deductible or a high deductible, I don't mean this to sound commercial. So whenever I say Paytient, just sub it for anything that looks, feels, and functions like Paytient. But when you put Paytient on the shelf and you make it available during open enrollment, more employees willingly, organically, voluntarily choose lower cost health plan designs. So that's helpful to them in their own family life. It's helpful to the employer as well. When people choose lower premium health plans, they save money, their employer saves money, and folks willingly accept to take on more responsibility, more that equip them to be able to take that on. And so what we see is we put Paytient on a shelf, there's plan migration that occurs, more people move into those higher deductible health plans, willingly, voluntarily, organically. And so you're sort of meeting a need there. And then once folks have Paytient, whether they're in a low deductible plan or a high deductible plan, what we see is there's an increase in sort of earlier care. So folks are picking up their prescriptions instead of leaving them unfilled. Folks are actually getting preventative care and even the preventive care where like the procedures and diagnostics and the labs and things associated with that aren't free with the visit. Folks are actually getting that kind of care. And so you're sort of pulling forward demand that people would have been rationing. And so what we're doing is effectively what it's doing is it's causing more rational consumption of care rather than a rationing of care where they're not delaying, deferring care. You're actually causing healthier consumption of healthcare, which is beneficial for the member, beneficial for the plan sponsor, whether they're employer or the health insurer. It's beneficial for the providers in that they want to take care of you earlier and they want to spend more time with you. They sort of rightly and fairly want to be reimbursed so that they can cover the expenses of providing good quality care. And so what Paytient is doing is it's augmenting employer health plans and insurance health plans and giving people an easier way to self-pay for that portion of care that they have responsibility for. And so I think that ultimately, like what we're doing is we're helping healthcare to happen. And we're helping patients and providers to meet more often and to meet in a way that results in better outcomes for people at ultimately lower costs. We're equipping populations to take on more and more responsibility and feel and the paradoxically, like folks tell us, like it feels good. Like we really appreciate this. I appreciate the ability to take care of myself and my family member sort of in a permissionless state. And I think the phenomenon carries that, like, I think that what the phenomenon here is that like there's a natural human want to be able to take care of yourself and to take care of your loved ones without asking someone for permission. Like you want to be capable and not just enabled, but empowered. And so if you think on our work lives, like if we're given responsibility for something, whether it's a project, a task, a job and initiative, but we're not equipped to be able to carry out that responsibility, or we're not equipped or empowered to be able to make decisions about that responsibility. Like, if you give me responsibility to make something happen, but you don't give me any of the means to be able to produce that outcome, folks get anxious about that, frustrated about that, outright angry about that. And I think some of that is what is sort of bleeding through here, is as society has taken on nearly $500 billion of out-of-pocket responsibility, they don't just have $500 billion sitting around. And so we have to be able to equip people to not just enable people, but to empower people. And when you do that, folks actually say, hey, this feels good. I'm capable of caring for myself and my loved ones. I want more of this. And at the same time, I'm able to capture savings for myself as a patient, as a member, and it benefits the employer. So it's sort of a full circle effect here of putting patients, employers, plans, providers into a better place and creating healthier outcomes for everyone.
I love that. And also just from like an HR perspective, I'm reading HR trade journals and publications all the time. And what I'm seeing is there's obviously a rise on stress and burnout and things like that across industries. Part of that is we've got a ton of layoffs occurring, and a lot of them are in the tech space. But another one of the biggest stressors that I see over and over, doesn't matter the publication, is financial stress for employees. And
Yeah.
most employers are like, gosh, that's a personal problem. I need to make sure I'm focused on everything at work. And then I hope you get that figured out. Like, I hope you get your personal finances figured out. Not really a me issue. I'm paying you appropriately for your job. I'm giving you timely increases, whatever that is. But what your philosophy is essentially is helping an employer ease that financial burden. And when employers realize like we're hiring this holistic employee, and so we can't just ignore their personal finances because that is actually damaging their productivity and their efficiency at work. So if you just want to be cold about it, you're not getting what you want out of the employee if they're constantly stressed about their personal finances. So even if it's not altruistic and loving, this benefit is going to positively impact productivity for an organization because it's going to help impact financial stress on an employee. So I love hearing that.
Yeah, no, let's camp out on that for a second, because
Yep.
you hit several different themes that I think we should talk about and talk more about is that,
Yep.
yeah, you're absolutely right. Like for the employers, in a way, they're like, look, this is comp and benefits. I benchmark my comp and benefits to the market, that this is what it is. And the out of pocket is out of my reach. Like, I pay you this much in income. I don't control or have a say over like what's in your bank account. And so it's sort of like, that's your responsibility. So therefore it's your responsibility. They're not wrong. And it's not wrong to conclude that or to think about that. But I think that as the body of evidence grows, that you will see more and more evidence-based health plan design where we understand that the ability to pay for care influences consumption of care. And as we think about the kinds of healthcare that folks are denying themselves or deferring themselves, if they're able to get that care using their own dollars, so their own dollars, not plan dollars, that gosh, like the better we equip people to be able to self-pay for their own care, it changes health outcomes. Like, people insure themselves differently, folks actually get care. And if we ignore that like causal link between the two, at some point it almost becomes negligence, a strong word and a charged word. So I wouldn't say that, but it's like there's a matter of like hygiene. Like, within a hospital, every single room folks walk into, like, clinicians like will wash their hands, right? When they go patient to patient, like, you have to wash your hands before you go in. And like, in order to prevent nosocomial infections, which is catching diseases that in a hospital that you didn't walk into the hospital with. It's just a matter of hygiene. Like, if your doctor walks in your room, if a surgeon walks in your operating room and they haven't washed their hands, like that is negligence. That is not adherent to a standard of care. And like, everybody knows that it would be wrong to do otherwise because we understand what that relationship is, right? So if we don't, I think at some point, as the as this knowledge sort of diffuses across, the industry, folks are saying and say, hey, gosh, if our health plan has any bit of an out-of-pocket responsibility, we understand that our team or employees, that there's a bell curve here of people's ability to pay. We probably have 1, 2, 3, 4 size deductibles out there. And that deductible feels very different for folks, honestly, at both ends of the income spectrum. Like you can have a high earner who has no money sitting around and that is their issue, but it becomes because you're paying part of the claims, like it's also your issue as well. And so by sort of augmenting the health plan and giving folks an easier, empowering people to self-pay their portion in an affordable way that works, by helping to empower folks to self-pay, you're gonna essentially put people into a better place, and I think it becomes like a standard of care. I think it becomes just like hand washing within the hospital. I think it will become a matter of hygiene or a standard practice or a standard of care, that if you have a health plan where there is any bit of out-of-pocket component, that you'll have something like Paytient automatically built into the plan. And from our experience over the last 6 years and now serving 6,000 employers, that is coming true. So as of January 1, 2025, it is now a national standard of care, at least for Part D health plans. So Medicare pharma plans. As of January 1, 2025, it is illegal for a Part D health plan to not give their members a way to pay their out-of-pocket pharmaceutical expenses over time. So the Medicare prescription payment plan passed in August of 2022 and going live here in January 1, 2025, the 54 million Americans who have a Part D health plan, every single one of those Americans, their insurers now, as a national standard of care, have built into those plans the option for them to walk into the pharmacy when the pharmacy says, hey, Kerri, it's going to be $240 to pick up this prescription. That person is going to be able to essentially pick up their prescription, walk out the door. Their health plan, will pay the pharmacy for their copay upfront on their behalf. And then the member will essentially smooth or repay their insurer or their health plan over time without interest or fees. Paytient is very privileged to be in a place of an awesome responsibility to help power that program for nearly 40% of the Part D participants in the country, Part D beneficiaries in the country. And so that is going to popularize this thing that we've created and what we know to be true, which is when you help increase the ability of people to pay for care, it changes healthcare in 3 ways. It makes it more accessible, equitable, and affordable. And now nearly 54 million Americans are going to discover that as well. And everybody's going to know somebody who has a health plan where this is productized or standardized as a part of it. And I think then that will sort of diffuse and you'll see more and more employers, more and more employers and other types of insurers sort of build this in. It'll be like hygiene for a health plan. It'll be almost it would become, I believe, a standard of care as it relates to health plan design. And I think that it is going to put, to your point, employees, employers, and others into a better place.
Yeah. And I would say, first of all, yes, and I love that you're doing that. But second of all, you're coming across very humble, and I know you, so I know that's the way that you are. But just as another business owner, dude, heck yes, that you got this thing going. You got this thing going and got yourself in a position to be able to provide this because somebody had to do it. And I'm super proud of you and happy for you for doing that because you are on the forefront of this and it's amazing. I mean, and of course it is because if you can't go to Nordstrom.com, I don't know if Nordstrom actually has this, but They probably do, where you can get a shirt or whatever that is and like payment plan out your freaking designer jean. Like
Yeah.
if we're doing that as a society for our fashion, why in the world wouldn't we be doing it for our healthcare? Of course, like something that we actually live and die by. And so this has been a long time coming. I'm super glad that somebody that you got it going and what a huge impact it's making.
No, it's our, in a lot of ways, it's affirmation of our founding mission and thesis, which is we think that this is a more natural way. We think the most affordable way to impact affordability. Think about healthcare. If you think outside of healthcare, how do we afford expensive, infrequent purchases? So let's set aside the pair of jeans or shoes or something for Nordstrom. And let's think about like our homes, our cars,
Tires, yeah.
furniture, roof repair, something that, gosh, like it's a part of our life. We have to do it like the way that we as a society and like as a society for over 100 years, like we use credit, we use financing, we use it. And I'll just use the word time for that. Like we give ourselves time. We amortize that over time. And so we turn that really large one-time expense into, we use time to smooth that out, spread it out, because very few people can afford to pay cash for a home or a car, et cetera. But it's necessary for life. And so healthcare, well, it's life-saving, life-enhancing care delivered by some of the world's best trained people. It's always going to be, I think, expensive relative to other goods and services. And it's always going to be sort of episodic. You're probably healthy more often than you're unhealthy. And so those would be very ideally for most folks infrequent expenses. And so, gosh, expensive and infrequent over here in our society, we've solved that using financing and credit as an affordable way. And so just taking that concept and building it into health plans, into insurance plans, and to have this sort of hybrid health plan where it has the insurance is becoming more and more important for extremely expensive cures and therapies that are out there now and more are coming. The employer or the plan kind of was bearing more and more responsibility there. And as an offset, they're like kind of shifting costs and saying, hey, like your everyday care, that's on you, Kerri. So we want to give you the means to be able to live within the deductible most of the time, because that's where most of us live most of the time is within that deductible. And so if you can kind of change how that feels for people and ensure that when they're in that deductible, that they can live their lives and take care of themselves and their loved ones, I think that's a better product. And I think our traction today says that there's very thoughtful insurers and employers who are thinking about how do we provide the very best member experience and how do we ensure people are able to live happier, healthier, longer lives, even if they just stay within that deductible. And I think we've just been very privileged to develop partnerships with like-minded people who are trying to put members first and cause healthcare to happen and ensure providers are fairly reimbursed for the work and care that they're delivering.
Yeah. What hesitations or resistance in the market have you had regarding this model, and how are you addressing those?
Early on, folks, we're creating something that the world hasn't seen yet, or at least hasn't seen in this way. So it's a novel way to pay for care. And so, and now I think it is, truly, Kerri, to your point, like I think it's becoming a category. I think it's becoming a standard of care. But, in the earliest days, you kind of look like a bit of a crazy person walking around saying, guys, this is better. Here's what I think. I think it can work. I think it puts people in a better place. Your employees are going to actually love it. They're going to tell you that over and over. And so you kind of look a little crazy walking around. And so you're just sort of walking around out there amongst the sea of skeptics, trying to find a small band of believers to kind of pull them together and then start telling more and more folks. And so I think in the earliest days, CEO stands for like Chief Evangelical Officer rather than Chief Executive Officer. But that's the crucible one must cross to create a category. And it's trying work for sure. It's trying work. And it still is. It still is. But I think fortunately we've been sort of pointed in the right direction. I think that we are sort of others oriented, and we are approaching this from a mindset of humility. I sat inside a really large, great hospital for years and years and years. I would look out the window into the world and see all these loud and proud startups out there saying, hey, we're going to change healthcare and we're going to throw in stones at all the normal stakeholders of the system. And it really got to me. It really, over the years, it really developed a bit of a thick skin, but also perspective that there's not a stakeholder in healthcare. And I'm talking like generally here, but hospitals, insurers, benefit managers, there's not a person that we've ever met who says, who isn't mission oriented around, hey, we really do want to provide great care to people. We want to enable people to get better care at better prices. There is no villain in the system. And so our approach has been to approach this with love in mind rather than anything else. And like, we just want to help the system as it presently exists to work better. Want to come in, fill in those gaps, fill in those voids, make that very uncertain moment in people's lives a little bit more certain. We want to make that feel better. And oh, golly gee, like that creates a bunch of value for plan sponsors, for employers, for providers. Really is a better insurance product, and people like that insurance product more, not just from a net promoter score, which is ours is 90 plus, but like what I mean is that by like when people have Paytient as a part of their health plan, those people, when they have an opportunity to leave that health plan and choose a different health plan every year, they don't. They stay in that plan. They choose each year to stay in that plan. And so there's demonstrably lower member churn. So folks stay on plan for longer. That means that like insurers, health plans can invest more into those members around education, around like health outcomes, and give themselves a longer period of time to develop more of a relationship and to like change, to inform like where people go, when they go. And so, yeah, I think it's all about our approach and how we partner and serve others.
It's a gracious approach and appreciated for sure. So you've talked about the impact, and I follow you on LinkedIn. So I see some of those specific success stories that you post, and they're beautiful. And I mean, I see what the transformation it is in people's lives. So can you share for our listeners some success stories or examples of how this model has made a difference for companies or for employees specifically?
Yeah. So when you increase the ability of the population to pay for care, what happens? Folks get care, and people, responsibility feels good. It's empowering. And as Americans, like we want to be more responsible we want to have, we value independence. We value decision making. I want to, the more someone else pays my way, the more they get a say in where I go, when I go, and what I can get done. Well, I don't want my other folks sort of in my home, telling me where me and my family can go for care and where we can go for care. So I really, really think that there's like a sense of agency or like independence, self-determination that Paytient is sort of restorative of, or sort of empowers or engenders. And when folks are walking in to a dentist's office, a physician's office, to an urgent care, whatever, like if they're seeking healthcare, it's something's gone wrong in life, or someone themselves or a loved one doesn't feel well. So it's an incredibly uncertain moment. What we're giving people is a feeling, not a financial product. It's a feeling that they're now empowered and capable of taking care of themselves and their loved ones. There's an emotional release. It's incredibly evocative. And so people often tell us all day, every day, in publicly, in voluntary, non-compensated just, hey, Kerri, tell us how this goes. And would you mind submitting a public review? And people smash the yes button and then tell us, gosh, there's a great one that just came through yesterday. And I'm going to just, you're asking. So I've got,
do it.
so she said, it was great. I had a slow week at work, made all the difference to be able to buy things we need for our health. It's helped me with my doctor's appointment right on time, my medicine. My sister has cancer and I bought her many things she's needed. Thanks, patient. And so like we hear just evocative, emotional stories like that, and people tell us those and give us permission. Actually, they were submitting those to a public facing review service called Trustpilot. And so again, we don't compensate for any of these things. We just want to know, or we provide opportunity for people to share things. And I think paying for care is often the most painful part of getting sick. Certainly the most frustrating part. Gosh, I don't feel well anyway. And I'm here. I don't want to be here. No one wants to go to the doctor's office. 99% of things. Some things are joyful to go there about. But it's like, I don't know how much this is going to cost. Whatever number comes out of their face is probably a number that I'm going to wince at. And gosh, I don't know, like no one is really just setting cash aside. The folks who have really, really large HSAs, those are backdoor retirement accounts for many, 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 many people. Not all people, certainly. The HSA is an amazing way to pay for care, and will become more and more and more relevant in people's lives. But for most folks, paying for care is the most painful part. And we're trying to give people certainty of affordability. We're trying to empower folks to take care of themselves and their loved ones in that moment. And we provide opportunity for them to share with us because we want to know and we care about members. And people tell us some amazing personal things. And they say, hey, like patient, I actually want to tell the world this. And we let them share that story with the world. Because I think the more folks know, I think the more that we can help establish this as a standard of care. Because I'll say that. I would say like, we want this. We need more people out there sharing what we know to be true. With that, we need to improve the ability for folks to pay for care. Folks actually get care. And when you empower a person's ability to self-pay for care, there's this emotional release, and gosh, that creates value for others. And so we want more folks to know what we know to be true. And for this to continue, we want to fast forward the future that I think is inevitable, which is, I think this will become part and parcel of every health plan in the country. And I think that's a good thing for the whole health system.
Yep, I agree. So let's shift gears just a little bit. I want to talk to you about what it was like when you transitioned from like a traditional healthcare role in that setting to leading a startup, because that's quite a shift. And you've mentioned like the chief evangelical officer and things like that, because that's true. You go from being in an organization to running an organization, building an organization. And I can remember the first time you and I met and you were explaining Paytient to me, and I was like, this is a really good idea. This is a good job. Way to come up with this idea. But it's a completely different change of pace. So what has that been like for you transitioning? And talk to us about what you learned from this experience so far.
Oh my God. So many things. So yeah, I think the organization now is just, after 6 years, it's just getting to kind of like the scale where it's starting to feel familiar again. So like all the kind of muscles and things you have as a manager, administrator, leader, director, like within a large organization, like it's starting now to be like, oh, okay, there's a budget cycle, and there's a financing, and there's a HR process, and like all the things that were like usual that like, or would be like recognizable to a large company person. Like now, if they walked in the door, they'd be like, oh, okay, there's a process for that. I understand that. Still not a process for everything, but for most things. And so it's starting to feel familiar again. Unfortunately, in a lot of ways, I think having experience is helpful. I think I'd credit a lot of our success to just the good practices that we've learned. The hospital and health system that I worked for previously, it was a great organization. They really prized providing high quality care and taking good care of people. I drank all the Kool-Aid. I listened to it. They trained me. And so I think the approach to management here, it feels a lot like a healthcare organization, probably not an accident because we're bringing all that sort of ethos and DNA into the company, not just through me, but the folks that we hire. Daniel Lynn and I, who's my partner, my long-term business partner, this is our second rodeo together. We had a first rodeo and that went well. And so you have kind of at the nucleus, like a founding team where we can complete each other's sentences. I can just look at him and know there's a shorthand already there. Most startups die on the launch pad. They die through inexperience and negligence and other things. And so there's just a lot of experience that we have. And certainly as we have grown the company, there's just, I think you used the word humility earlier, and that's not this, and that's important because we understand that this mission is bigger than ourselves. We have an opportunity literally to help power this new national standard. It's an enormous opportunity, and we're going to need an enormously talented team to bring in and help us serve out and fulfill our mission. Yeah. And so our ability to be oriented to the team and to sort of set direction and create accountability structures, but then at the same time be selfless and give people an opportunity to do something really, build a product that's really meaningful and impactful. And yeah, I think all that sort of goes together. And so the early days, they're super, super early days. It's a lot of alchemy. It's the magic of trying to just really intensely focus only on the things that matter. And that's early on. It's build product, sell product, listen to what people are saying about the product. But it's a lot of intuition, and you're sort of intuiting what does the market need? Where's the market going? And I think that we're building kind of years out ahead of that. And so I think that intuition is honed by experience, and particularly in an industry like healthcare. It's a serious matter. Well, we're providing something that has to work. There's a lot of trust when people are at the provider's office. They need our product to work. Like, they want that product to work. And so there's a really real moment of trust there. And so the kind of startup kind of ethos mentalities that are foreign to us, I think kind of work against those startups as they're sort of entering their space. There's not a respect. Maybe that's harsh. We understand how much trust folks are placing in us. We understand how much responsibility we have to serve their members. When employers and benefit consultants bring us in, their benefit structure, like I'll use a sacred thing, but it's important. It's important, and we're guests in their home, and we are saying that we are going to make their employees' lives better. We're going to help them find savings, put people in a better place, et cetera. And so, like, we just really take that very seriously. Every sale early on is hard. And so we're just of the mentality like, hey, gosh, let's just hang on and serve our clients and expand with them and solve more and more of their problems. And if we do that over and over, and we hear the things that we continue to hear, like, I think this will I think we're gonna be in a good place. We're gonna build an enduring, impactful, invaluable company serving others, and that's what we're about. So
yeah, and you've passed that. I don't want to say dreaded, but that like eerie 5-year mark where the data kind of drops off with startups. And I would say, listeners, if you're somebody who listens regularly, how often I talk about trust in an organization. I reference the book The Speed of Trust by Stephen M. R. Covey so often. And I did not talk to Brian about that before this episode, but listen to him talking about, as a CEO, the importance of trust internally, which then he talks about trust externally with partners and consumers of the plan or consumers of the product. And so that is so key to have that trust internally, whether it's with your specific partner, Brian, or with everybody on your team. You know what that looks like. If there's not trust, everything slows down. You talked about like the short arm That's so true. You guys are able to do the shorthand with each other and
Yeah.
move faster. And when you've got a startup that's scaling, the ability to move faster is crucial.
Yeah.
It's so
Early on,
crucial.
that's the only advantage you have. That's the only advantage.
You take what you can get, right? Like
Right.
you're looking for something. Yeah.
Yeah. And so it's incumbent on us, I think, to create an environment, an enable environment of high fidelity, high velocity business decision making. It's true in all organizations, but it's especially in a startup one. Just information has a half life, and so like nuclear decay, like a radiation. Like if you think the half life of information is 90 days, like half of everything I knew to be true today is not true in 90 days. If the half life information were 90 days, then that means 1 year from now, 6.25% of all your, out of the 100 decisions you make today, only 6 of them are relevant a year from now. And I can tell you with certainty that particularly in a high growth environment that's incredibly dynamic, where there's new news and new information, you're learning new facts on a weekly basis, the half-life is not 90 days. And so that just means that, hey, gosh, we need to really communicate a lot within the team so that folks understand what is true today, so that they're able to have a basis of fact and truth when they make decisions, and they can understand what's going on around them. And then what we need to do is, as you transition away from like intuiting decisions to basing the decisions on, rooting those decisions on data and fact and information available, like we want to cause and enable high fidelity, it's like fact-based or data-based decision making. Hopefully you're getting to that decision in a consistent way across the company. And we want to then do that faster and faster so that we get bigger and faster as an organization, not bigger and slower. And so we share a lot of information about, hey, this is where we are. This is what we think the future is going to be 90 days from now, a year from now. We talk about that often because as the company scales and new people join the company, we want to quickly establish common basis and language so that we have common understanding. So then we can actually get to trust fast so that we can then talk and debate within ourselves around what to build, how to serve, et cetera. And so just help us faster.
And not to put you on the spot, but what are your company values? Speaking of, you're obviously hiring people based on those and then onboarding them based on those and measuring performance. So what are those at Paytient?
Yeah, it's lift others, live the mission, and light the way. So we have three kind of core values. And really, in 2 of those, we're trying to encode. You've probably heard me say the word selfless a lot. And I think we are a healthcare company. We are serving others. That is an ethos that was carried into the company. That at founding, I truly believe that, yeah, we're improving the ability of people to pay for care, but what the value we create is all based on the health outcomes and the actual plan savings. Like the value is all based in changing people's behavior, how they insure themselves, and what kind of care they're getting now that they have the ability to pay versus not. So it's all based on health outcomes. And so really wanted to root the company and encode our ethos of serving patients, serving others into the values that we use to screen, retain, terminate folks, consistently refer to the company as a team, not a family. We care about folks. We ideally we're a community of folks with common and shared purpose and understanding. And we're working on something that I think whenever you're doing something for someone else, that's when you're at your best. And I want as many folks to sort of know and live what that feels like. This is growth for me personally. I'm finally doing in my life what I feel like I'm supposed to be doing, but I wasn't able to do this 10 years ago, 15 years ago, or 20 years ago. I wasn't able to do it. Now I can carry all those lessons, all those mistakes, everything forward and to try to help as many people as possible find fulfillment in the work. And it's hard, Kerri. It is hard. We work long hours. We are doing, we work long hours that ideally comes out of it. So we're not trying to get somebody to click a button for this and that. Like, we're trying to help people better access for care, and that has meaning. It's a lot of responsibility, and we take it really seriously.
Well, thank you for not failing the challenge. I didn't tell you I was going to ask you what your company values are. And if you are a business leader listening to this episode, let that challenge you. If you can't spit that out the way that Brian just did, that is something to work toward. And I mean, work toward this week. Like, get into your values. If you don't believe in them, rewrite them. But you will be able to spit them out if there's something that you truly believe in and they're truly alive inside your organization. And plus, those employees want those. They want to attach themselves to something like that. So good for you for having those. That I'm glad that didn't go differently when you were like, oh, actually, my HR person.
Let's do this part again.
Yeah. Pause and let's re-record that part. So I love that. And that's what, in a client, that's what I would ask for, is that especially a CEO needs to know what those are and live by them themselves, or strive to work toward it, meditate on it, and inspire others toward that. So that's awesome. Brian, anything else you'd want to add before we wrap up today's episode?
No, I did really appreciate the opportunity. Our company is Paytient. It's it's like hot. It's a Paytient, so Paytient. And folks can, if they're curious to learn more, if there's anything that if they find resonance with this and they're like, gosh, that seems to make some sense, or folks are like, you know what, I have a completely different view of the future, and I really want to debate or reach out or share my point of view. Part of my job is to listen to the market and to just engage with folks. And so if anybody wants to reach out and say hello to us, we're easy to find. We're at paytient.com, Paytient.com, and really appreciate, Kerri, the opportunity to share what we're doing with your audience.
Yeah, absolutely. And folks, I'll link Paytient's website in the show notes. I'll also put a link to Brian's LinkedIn page in the show notes. You can track him down there as well. Listen, we know that determining how to spend on your P&L toward compensation and benefits is tough. It's a big expense. It's one of your largest. And whether you're an HR pro or a business owner, so many of us are just hitting renew on those plans without truly understanding what it is that we're offering. And it's one of our largest expenses, one of our largest line items. And so digging in and understanding this feels like chaos. It can feel like chaos, but it is worth it. Don't waste this chaos. Embrace it. Till next time.